Welcome to Medical Logistics 101, Appendicitis Overview. This video is for educational purposes only. It is not medical advice, does not replace a medical evaluation, and may not apply to your situation. If you have symptoms or concerns, please speak with a licensed healthcare professional. My goal is to help patients enter healthcare with a map instead of a blindfold, and to explain how clinicians think through these problems in resource-limited settings. Appendicitis. It's inflammation of the appendix, usually caused by a blockage of the small opening that drains it. Once blocked, pressure builds, bacteria multiply, and the appendix becomes swollen and irritated. If the process continues, it can progress to perforation, which is where the real danger comes from. Symptoms. Common symptoms of vague discomfort around the belly button that later shifts to the right lower abdomen, loss of appetite, nausea or vomiting, low-grade fever, worsening pain with movement, abdominal pain with coughing or bumps in the road if you're riding in a car. Exam findings: tenderness in the right lower quadrant on palpation, guarding muscles will tense when pressed, rebound tenderness, pain when pressure is released, pain with walking or lifting the right leg. Oftentimes we'll do a straight leg raise just to check for this. Early appendicitis often presents with nonspecific generalized abdominal pain. The classic right lower quadrant pain may not appear until later. Differential diagnosis: mimics. These are conditions that can look like appendicitis, especially early in the process. Ovarian torsion, sudden severe pelvic pain, ectopic pregnancy, so-called tubal pregnancy, kidney stones, a sharp radiating flank pain that radiates down to the groin, mesenteric adenitis, viral illness in kids that can mimic appendicitis, and of course gastroenteritis, very common, nausea, vomiting, sometimes diarrhea with a cramping abdominal type pain. Differential diagnosis: mimics. Crohn's disease, Crohn's flare can cause inflammation of the terminal ileum, producing right lower quadrant pain. Generally, of course, these patients will usually give you the history of Crohn's, which kind of narrows that down. Hernias, localized pain that worsens with strain. UTI or pyelonephritis, lower abdominal discomfort with urinary symptoms. Constipation can cause significant right lower quadrant discomfort. And of course, ovarian cyst rupture can cause sudden pelvic pain. See a lot of that. Labs, CBC may show elevated white count, but can be normal early in the process. Complete metabolic panel, or CMP, helps rule out other causes and assess overall status of the patient. Urinalysis helps rule out UTIs or kidney stones. And a pregnancy test, when applicable, critical to rule out ectopic pregnancy or tubal pregnancy. I would point out, of course, tubal ligations don't eliminate the need for this. I have certainly seen ectopic pregnancies in women who have had a previous tubal ligation. Imaging. Ultrasound is often the first line in kids and pregnant patients. CT scan, kind of the workhorse, the one we use most of the time for this. Most accurate for adults, shows inflammation, swelling, or complications. And rarely MRI is an alternative when radiation is a concern. Red flags. I would say severe abdominal pain that worsens over hours, pain that suddenly improves. That can be from perforation, which the pain will temporarily, some of the pressures relieve, the pain temporarily improves. High fever or chills, inability to walk upright due to pain, persistent vomiting, rigid abdomen or severe tenderness on palpation, pain with bumps in the road, as I said, riding in a car, or movement of any sort. Pitfalls: assuming early pain must be viral, attributing the symptoms to a viral cause such as gastroenteritis. Normal labs early in the process, white count can lag behind the symptoms. Atypical location of the pain, especially in pregnancy or in a situation where you sometimes have what's called a retrocecal appendix. The appendix is in a different spot than it normally is, can produce atypical pain symptoms. Focusing on vomiting instead of the abdominal pain pattern. Anchoring on a prior diagnosis, particularly someone that has a history of constipation. They may want to attribute that as the cause. Relying on the absence of fever. Oftentimes these patients won't necessarily have fever. In closing, if this is the kind of content you found helpful, please like and subscribe. If there are topics you would like to see covered, you can email me at medicallogistics101@gmail.com. Remember, the danger isn't always what you know, but rather what you can't afford to miss. Thank you.